All right. Well, welcome everyone. Welcome to a Southeastern Caribbean Disaster Resilience Partnership Resilience in Action Forum. My name is Claire McGrath, and I am the director of SCDRP. So if you're just joining, feel free to drop your name, affiliation, and location into the chat so we can get an idea of who's joining. To start, I want to acknowledge and thank our benefactors and partners. Thank you to the Indian River Lagoon National Estuary Program and NOAA Southeastern Caribbean Regional Collaboration Team, or CCART, for serving as benefactors of SCDRP. We are also grateful to our sustaining and supporting partners, IEM, Moffitt and Nichol, and Georgia Tech Center for Sustainable Communities Research and Education. SCDRP is a program of SCORA, the Southeast Coastal Ocean Observing Regional Association, which is a 501c3 nonprofit organization. To learn more about SCORA, you can visit scora.org. At the beginning of each forum, we'll reserve a few minutes for you all to share any funding announcements, job opportunities, events, collaboration invitations, or any other regional updates. So you can either unmute yourself to share or drop your announcements into the chat. I'll start us off today with a few SCDRP and regional announcements. If you are a local government or tribal employee in Florida, the Florida Silver Jackets are inviting you to take the Flood Observation Survey. The survey results will be used for a project led by the Florida Silver Jackets in collaboration with the Florida Flood Hub to inventory existing tools for reporting flood observations across the state. And you can use that QR code there to get to the survey, and it will also be sent out in tomorrow's SCDRP newsletter. SCDRP has released Stronger Together, Partnerships, Capacity, and Collective Action. This report and action plan is a culmination of the discussions and ideas shared at the Emergency Management Roundtable held in Charleston on March 6, 2026. This report serves as a resource for the Southeastern Caribbean region and beyond, and it illustrates how to strengthen local emergency management capacity, especially in under-resourced jurisdictions, by leveraging non-traditional partnerships and creative funding strategies and collective mobilization. You can access the report on our website, scdrp.scora.org. It's right on our homepage or at the QR code on your slide. Our next Resilience in Action Forum is Sargassum, the Southeastern Caribbean's emerging disaster. It'll be on July 23rd from 10 a.m. to 11:30 a.m. We've made this one a little bit longer because we have 3 fantastic panelists from Puerto Rico and the U.S. Virgin Islands to talk about how sargassum has been impacting the Southeastern Caribbean and what to do about it. So to stay updated and sign up for forums, you can head over to our website, scdrp.scora.org, or follow us on LinkedIn, or sign up for our newsletter. The button to sign up is right on our homepage. Next, I invite anyone who has any announcements to share them with the group. You can either drop them into the chat or feel free to unmute yourself to share any regional updates, events, job opportunities, anything like that. You can also submit opportunities to our collaboration hub, which is an easy form where you can submit resources or requests. And we share those primarily through our webinars, newsletter, social media, and website. So anyone have any announcements to share? And if not, we will move along. If you do have any announcements, feel free to put them into the chat and I'll pick them up for our newsletter, which will be going out tomorrow. All right, so next I am pleased to introduce Dr. Ashley Ward, our presenter for today. Dr. Ashley Ward is the director of the Heat Policy Innovation Hub at Duke University's Nicholas Institute for Energy, Environment, and Sustainability. She leads national efforts to quantify the economic and health impacts of extreme heat and translate those findings into bipartisan policy solutions. Her work spans congressional engagement, modernization of federal cost-benefit frameworks, and collaboration with private sector leaders and insurers to align resilience with fiscal stability. Dr. Ward's research focuses on economic risk, rural vulnerability, energy burden, and financial innovation to support long-term climate adaptation. She holds a PhD in geography and specializes in bridging science, economics, and policy to advance practical resilience strategies. So without further ado, I will pass it over to you, Ashley. Give me just a minute and I will give you screen sharing permission.
Thank you so much. It's great to be here with everybody today and to pick up on the conversation that we started at the annual meeting. I am going to share my screen. Okay, I think, is that all good? You hear it, Claire? Okay, I see it, Claire, rather. Hear me too? Okay. All right, that means everything's working. Okay, so I am operating, I'm going from a multiple screens on my desktop at home and I'm out in the field. So now I'm reduced to one laptop. You all know how that is. You can't navigate everything, but you'll have to forgive my slowness. Some of you were in the room for the original panel at the annual meeting, and some of you may be coming to this today, to the conversation fresh. So I did want to begin by briefly recapping the argument sort of that I made or proposed at the annual meeting. There I focused on extreme heat as a governance test. It doesn't move through government like a hurricane, wildfire, tornado, something we're all familiar with. It's not always a single visible disaster. And instead, it often operates as sort of a sustained condition that strains our systems over days and weeks and even seasons. And that creates a real policy challenge because heat crosses a lot of institutional boundaries. It affects systems that shape our daily lives, where we live and how we work, and whether the power stays on and children can learn and play safely, whether our health systems can absorb increasing demand, and whether our local governments can respond in timely manner before conditions even become dangerous. So there's no single agency or level of government that owns all of those systems. And so my original talk focused on 4 lessons from our work engaging with policymakers. I'm just going to review those real quickly. The first was that institutions act through the tools that they control. Agencies and legislative offices, local governments, and private sector actors, they don't respond to the issue of heat sort of in the abstract, right? They respond when heat connects directly to their authority, their budget priorities, their liability, operations, and a mission of their organization. The second lesson is that we need to keep the field of view broad. If we define heat as primarily and only a public health issue, we miss the way that the issue also impacts housing and labor and energy and infrastructure, business continuity, agriculture, education. And so it's important, of course, public health is central and remains central, but many of the decisions that determine public health outcomes often sit outside the sector of public health. So the third lesson is that we need to connect the issue of heat directly to the responsibilities of the people that we're talking to. Whether it's a policymaker or an agency official or a business leader, they're more likely to act when we can show how heat affects something that they're responsible for managing. And that goes back to what I was saying a moment ago, whether that's continuity of operations or workforce stability or grid reliability or any kind of fiscal exposure. The fourth lesson was that we need to frame our proposals in ways that can traverse political and institutional settings. In federal conversations, we have found that using terms like volatility and avoided cost, continuity, risk reduction, this opens more doors than language that immediately sort of triggers bipartisan shorthand. I don't want to be careful. The point is not to avoid the science or to soften the impact of heat. It's to translate the risk, the issue that we're talking about, into the decisions that people control and doing so in ways that they can hear. And so that was the core message of the first talk that I gave. It culminated down to this really clear statement, which is we don't advance resilience by winning arguments. We advance resilience when we can align incentives and give institutions a practical way to act. And this is kind of where today's webinar picks up. Several questions came up at the annual meeting that we didn't have time to answer. And so a lot of those questions really ask for more information about how we can move from, this framing that I proposed into more implementation. What does that mean in practice? So how do we align incentives when our values don't align? How do these processes and products or tools actually reduce risk? How have scientists responded to this framing? And should heat waves be, or extreme heat be part of national conversations around federal emergency management reform? So I want to use those questions that were not answered in the annual meeting to kind of frame the presentation for today. And still, my argument is that heat policy will not advance through awareness alone. It will only truly advance when we connect whatever protection we're talking about with the authority, financial structures, enforcement authority, and institutional responsibilities. So I looked at the audience that had registered for this webinar. And I think the audience that registered for this webinar is a real indicator of what the actual heat governance landscape looks like. About a third of you work in local government, including emergency management. Some of you work in planning and other kinds of related roles. About a fifth of you come from the private sector, and others are academics and nonprofit leaders, state officials, some federal partners. I think that mix is really telling and indicative of the point that no single institution can own or solve this problem alone. Local governments often do carry much of the operational burden of this issue, but it's the states that control the legal framework of that and the agencies at the federal level that shape funding and eligibility for funding. Private sector actors cannot be left out of the room. This is one of the things, I hope if there's nothing else you hear from me today, it is this, is that private sector actors own and operate much of the infrastructure that we rely upon. And they employ many of the people who work in high heat jobs. So we can't leave them out of the conversation. Researchers do a lot to generate evidence, but that evidence can really only matter when decision makers can use it. So today I want to focus on what it takes to move from sort of this framing that I proposed into action. And the first thing I want to talk about is the fragmentation of heat policy. Heat policy doesn't fail because people don't care. That's not true. People do care. It fails because the responsibility to address the issue is so fragmented. Emergency managers often see, particularly around heat wave events, they see it first, right? It begins to drive up calls for service and shelter services and public warnings. But emergency managers can't control where, the buildings where people overheat. They can't govern rules that govern rental housing. They have no control over budgets that determine whether schools can upgrade their infrastructure, HVAC infrastructure, or even workplace practices. And you could say the same for public health agencies, right? They can definitely help us understand illness pathways or how people get sick. Um, but often public health has to rely on other agencies to change the underlying conditions, the social determinants of health, if you will, that produce health outcomes. So emergency departments can issue guidance and they can issue a warning system. They can't retrofit a home or change a work schedule or keep power on during a high heat event. And speaking of power, utilities, mostly privately owned, um, they do manage grid stress. That's true, but they're not the ones who set the rules about rental cooling and tenant cooling, or they don't tell a school whether or not they need to move activities inside from outside, or day-to-day conditions for workers, or any of those things. And so I think this is the core problem of why heat policy can look very active on paper. You know, I have a lot of people that put together heat action plans and they're great, but sometimes it can look really active on paper but remain weak in practice. And that's because the institutions that each hold a piece of the solution puzzle, if you will, um, are not all together, and no one entity sort of holds the whole puzzle. We've been doing some legislative review at the state level. We've completed the Southeast. We're about to release California. We have another one coming on the Southwest and the Southern Plains. But our initial, the Southeast is already on our website, and I can send Claire the link. Um, and the California paper comes out at the end of the month, and I'm happy to forward that to everybody. But I think there are some interesting lessons from what we've seen so far. With our legislative analysis in the Southeast, 11 Southeastern states, lawmakers over 10 years passed 200, or introduced rather, 200 heat related bills. 79 of them passed. Legislators are paying attention to this issue, but they're not yet addressing it as a connected systemic economic risk at the same time. Much of the enacted legislation that we saw in the Southeast focused very much on the places that we're already familiar with, like school buildings and athletic safety, public facilities. And those are really important, but they leave a large part of the issue untouched. The region, the Southeast, still has major gaps in protections for workers, for example, or renters without reliable cooling. Um, it doesn't have really anything at all for small businesses, or how to deal with disruptions in transportation or surges in emergency response. I think the Southeast as a region shows a very common early stage pattern, which means that states begin to address sort of the most visible or the most administratively familiar pieces of heat risk, but they don't yet have a coordinated strategy for how it moves across our daily life or the systems that we rely upon. So compare that to California, which we've just wrapped. California is the most advanced state that we've reviewed so far. It does have a lot of heat standards, a heat wave ranking system, a grid stress planning tool. However, even in this in this proactive policy environment, California has not fully coordinated its authority. It has not integrated data across its agencies to deal with this. It has not created stable financing or the enforcement capacity. Almost everything is volunteer basis into a single heat governance system. I think that California represents a state that has many of the pieces, but the connections between those pieces remains incomplete. And I think this is a really important distinction. Even in an advanced heat policy environment, policy can remain incomplete if the state builds programs without the governance infrastructure to connect those programs. So the first lesson for me is this: coordination absolutely matters, but alone it doesn't solve the problem. A state or a region or some entity needs authority, and they need to be able to understand and have access to the data, and they need funding and implementation partners and accountability. Um, any coordinating entity without these tools basically can convene meetings. They can't really necessarily change outcomes. So this is why this to me is the core problem that governance needs to solve. And so the first question that I was asked was, okay, so what do you do when incentives don't align? And I think I would start with this. Incentive alignment does not require values alignment. People and institutions can absolutely disagree about the reason they want to act, and they can still do that and support the same practical intervention. It doesn't mean that we soften the reality of heat risk. People die from heat. Workers suffer. Older adults and renters and incarcerated people and our children and people with medical conditions, all of them face serious danger. That does not erase that, we should not erase that reality to make a policy conversation easier. However, we have to separate the value that motivates us from the lever that moves action. That's an important distinction. So a county, let me give you some examples. A county commissioner, might be worried about increasing emergency response costs, or a hospital administrator worried about surge capacity. A business might look at it from business continuity challenges. In a state legislature, a legislator might think about unfunded mandates. Those actors don't have to share the same motivation in order to support the same intervention. Because oftentimes, if you solve for heat, you solve a lot of other problems at the same time. So, cooling centers can reduce or protect public health, I should say, while they also reduce the burden on EMS. And workplace plans and protections will protect workers, but also it reduces turnover and lost time and liability. So the practical question for me isn't, can we make everybody agree with us? That's not, to me, where we need to be heading. The practical question is, what does each actor already have the authority to do? And the responsibility and the budget pressure to manage. I think that kind of question keeps the conversation grounded and prevents us from asking agencies to do something that's not in their purview. It keeps us asking public health agencies, for example, to solve a housing crisis, or emergency managers to solve energy affordability issues. This approach is incredibly valuable when there's genuine tension. One person might come to this issue from a worker protection perspective, absolutely fair. And they might be talking to someone who's thinking about business continuity. Those aren't the same values. We don't need to pretend that they are the same values. But both of those actors can support heat safety training, hydration, rest breaks, schedule adjustments, emergency protocols, because those same measures that protect workers also protect operational disruption. There's so many examples, but this approach is not weakness, right? This approach that I'm describing is actually how policy coalitions work. The harder case, I think, to solve is the one on mandates. Mandates impose real costs. So we might think of something like a temperature standard for public schools that will protect students and staff. But in order to do that, districts need capital dollars. They need time to upgrade their buildings. They need technical assistance to know what to do. A backup power, we heard this example in another meeting, backup power requirements for skilled nursing facilities. Absolutely going to protect residents during power outages. But facilities need a way to pay for that. They need a way to maintain it and replace it when it breaks. This is a point that came through very strong in our legislative analysis across the states. Legislation that is aimed at protecting people at scale will continue to fail. And it failed over and over in California, the most progressive policy environment for this in the country. It will be vetoed if lawmakers do not also account for the financial impacts on government and private sector actors. That doesn't mean that we need to abandon standards. That's not what I'm calling for. What I'm saying is we have to design standards that can survive implementation. So a standard without financing is going to fail politically. And if it makes its way through without the financing, it's going to harm the people you're trying to protect. In the opposite side, financing without any kind of standard can mean that the actors that have the most capacity to move forward are the ones that do, and it leaves behind those that are most vulnerable. So, when I think about this, I think about plans without enforcement. Really great to raise awareness, but don't really change conditions. So the strongest policies connect protecting people. I've forgotten what's on my next slide. Here it is. The strongest policies connect protection with money and technical support and accountability. We need those things to make sure that the protection, the intention is real. And that is where incentive alignment becomes more than just a communication strategy, right? It becomes a design principle that has to be part of the intervention design from the beginning. How are you going to pay for it? How are you going to maintain it? So let's talk a little bit about financing. Why does financing have to sit at the center of legislation? In both of those reports, the California and Southeast report, both report to the same conclusion. Financing can't happen after the policy. It has to be part of the policy. Almost universally, policy that were proposed failed or were vetoed when they weren't accompanied by the appropriate financing mechanism. So a bill can aim to protect people, and it'll still fail if the lawmakers and agencies and private sector see it as an unfunded mandate. And that really has nothing to do with whether or not the policy lacks merit. It doesn't lack merit. Most likely it absolutely protects people, but it hasn't solved the implementation problem. And so there are a few good examples I can provide here. Back to that example with the residents in the nursing homes. Good policy doesn't just stop at the requirement of having backup battery power at rest homes. It has to acknowledge that the facilities themselves have to purchase the equipment and all of those things that come along with it. And these facilities often operate on very thin profit margins. And so if lawmakers were to propose and implement that standard without a financing pathway, they're inadvertently creating a new risk, meaning a lot of facilities close. So now we have reduced access to care, and that's a different problem. And that wasn't the intent. So, I guess a lesson here is policy outcomes don't always follow policy intent. The same logic can apply to schools when we think about how we put cooling in schools. What do you do then about older school buildings and districts that have a lower tax base and less credit? If lawmakers don't pair the standard of upgrading school HVAC with financing mechanisms, they're going to reinforce the disparities that already exist. So when we talk about heat legislation, I think we have to ask a practical set of questions. Who is protected? Who's responsible for compliance? Who pays for it? Who enforces it? Who measures whether it worked? Often what we see is legislation answers the first question and leaves all the other ones really vague. And that's when policy runs into political resistance or implementation failure. And I think California's record here is especially instructive. They've committed substantial resources to heat, but our analysis finds that grants and annual appropriations alone don't sustain the scale of investment that this problem needs. Heat infrastructure needs a capital horizon. Things like schools and nursing homes and correctional facilities and local governments, they need long-term financing tools that match the cost and the lifespan of the kinds of investments that need to be made. Now, in the California report, we recommend something like a dedicated heat resilience revolving fund, very similar to what you all are probably aware of with the state revolving fund loans, a revolving structure that can support long-term investment better than one-time sort of grant alone. It can help policymakers also sort of pair standards with feasible compliance pathways. So this is a good idea outside of California, everywhere. Every state that wants to address heat is going to face this issue of how we fund these infrastructure upgrades. Every local government that wants to protect residents is going to face this issue. So heat protection often requires sort of an upfront investment, but the benefits of that investment usually show up in things like avoided losses, fewer illnesses, fewer emergency department trips, so on and so forth, fewer school closures. And that kind of creates a budget problem because institutions often struggle to pay for avoided harm because that doesn't really show up in your line items, right? And so we have to have the right financial tools also that recognize risk reduction as an investment strategy, not like a discretionary add-on. And this is really important, I think, for people across the board, especially local governments who rarely are able to solve the whole financing problem by themselves. And so I want to kind of propose a different way of thinking about two statements. One statement is we need to protect people from heat. That's true, we do. And the second statement is we need to upgrade our facilities under certain standards with these partners using this financial tool to reduce this kind of measurable risk. What is the difference between these two statements? The first statement builds awareness, but the second one is the statement that moves money and investment. So to that end, there is a second question, a fourth question, I guess, rather, is how do we use different financial tools to drive this risk reduction? Can we use them? And I would say, yes, we can use tools to help us, institutions, buy and fund the investments they need. And these administrative tools really matter because institutions act through these administrative tools for the things that they control. Like local governments issue their RFPs and state agencies define eligibility and federal agencies interpret statutory authority and budget offices look at costs and score them. Procurement offices write specifications. Grant programs define allowable expenses. So this is where heat policy can really have a lot of impact when it can change these kinds of tools. So let's take procurement first. A city or county may not be able to pass like a sweeping heat ordinance, but it can change the way it buys things. It can require heat safety plans in public works contracts. It can require cooling performance or backup power in certain facilities. It can make heat risk a part of event permitting or outdoor vendor requirements. It can ask contractors to show how they protect workers during heat season. Those kinds of procurement changes reduce risk very effectively because they do it through the operational setting where the exposure occurs. And they also avoid a very common political trap. Instead of telling every private actor what to do through a mandate, the government says, hey, if you want public dollars, cool. You just have to do these basic heat safety things in order to get them. That kind of framing often travels better. It links standards to public spending and liability. It creates market signals. Vendors begin building heat and safety into what they do because they want the public contracts that reward it. Cost benefit methods matter too in this scenario. They determine which investments appear worthwhile. So heat adaptation usually loses in the conventional cost CBA, because it doesn't damage assets in the same way that other things do, like fires, destroy buildings. If analysts don't count the avoided costs and all of the other ways that we think about how heat affects our communities and our systems, like grid strain and overburdening of our public agencies, heat investments look less valuable than they really are. And so that's really important for all kinds of grant programs and hazard mitigation funding and infrastructure planning. And so I think it's really important that we think through, say, if we're going to propose a school cooling project, that we also think about things like avoided heat illness and fewer school closures and improved learning outcomes. It's important that we count all of the aspects of avoided loss across multiple different sectors. And this is where research can make a really important contribution. Researchers can help local governments and state agencies and federal agencies and private sector actors identify the costs that they already experience but maybe don't quite measure. And that includes things like cost to health systems and all of the other sectors that we've talked about. Numbers don't make the moral argument unnecessary. What they do is they help institutions act. We have seen this repeatedly in our shop. We can demonstrate avoided health costs and stabilize workforce productivity, reduce strain. And so what happens then is policymakers aren't hearing environmental spending, they're hearing risk reduction investment. And that shift helps adaptation compete inside the systems that already demand sort of fiscal justification. And so I think these things, yes, procurement, CBA, administrative rules, they can all move the needle. And they move it because they change the rules of the decision itself. They help institutions buy safer services, and they help them fund better projects and avoid harm. And it's not flashy. It's kind of boring, that work sometimes, but it is some of the most important work in heat policy. Okay, so the other question, what scientists learn when they engage with policymakers? Do they push back or do they get it, is what I get asked. And the answer is kind of both. Many scientists understand the need for translation. They know that evidence doesn't move automatically into policy. They know that decision makers face all kinds of constraints, but they want their work to matter. And they appreciate guidance on how to make their work more usable. Some scientists do push back. That's true. Often for understandable reasons. I mean, they spend years building precision. And they worry that translation ends up oversimplifying what they've done. They worry that sort of an economic framing erases their concerns over health and justice. Absolutely understandable. They worry that policymakers are going to cherry pick findings and turn it into something that it's not. And that ultimately sort of thinking about things as I've proposed them will dilute the science. And I think all of those concerns absolutely deserve respect. Bad translation can distort evidence, that's true. And political messaging can flatten the nuance of everything. Scientists should guard against that. But translation doesn't necessarily require distortion, it requires discipline. That would be my argument. Scientists don't need to say things less accurately, they need to say them more usefully. And that's not the same thing. A policymaker doesn't need a full literature review. They need to know what decision the scientific evidence supports, what population or system is at risk, what action falls within their authority to act, how can they think about avoided cost or the return on investment, and then what happens if they do nothing. So that's a little bit of a different question than scientists usually ask. Scientists are usually saying, like, what do we know? What do we not know? But really it's who can act on this and what exactly can they do? And that's an important distinction because the evidence often cuts across multiple sectors, and people need to be really thinking through what those bridges are. So when scientists resist translation, I try to make one point, and that is evidence that does not reach a decision point does not protect people. That does not mean every scientist must become a policy advocate. It means that scientists who want impact should understand the decision systems their evidence enters into. They can make their research more effective, useful by identifying the scale of the decision, the actors that make those decisions and use their evidence, the levers that those people control, and how we're going to measure its efficacy or return on investment. I made this point at the original talk in a federal context. If we lead only with sort of abstract climate or health outcomes, offices almost universally narrow the conversation very quickly. If I kind of lead with things like fiscal exposure and health system strain, workforce productivity, military readiness, it sort of opens the conversation to a lot of other possibilities. So I want to be careful. I have a public health background. I'm in no way arguing that we abandon the health science. What I'm saying is we have to spend time connecting that science to the responsibilities that policymakers have. And that's the difference between sort of evidence as information and evidence as a tool. Okay, the last question I think is about federal emergency management. I think my answer is going to probably surprise a lot of you. Yes, I do think there's an opportunity in emergency management reform, but we have to be really precise about the problem that any kind of reform is trying to solve. So, as all of you know, I feel like I'm speaking to the choir when I say, you know, that federal disaster framework is built around events that cause visible, measurable, acute damage. Hurricanes, floods, fires, tornadoes, those things. Heat produces a different damage pattern, one that's not visible in that way. You all know that. I think that the innate tension between these two things, this mismatch, is a real federal policy gap. If federal disaster programs depend on visible physical damage, heat's going to remain hard to fund, even when the human and economic losses are really severe. So if public assistance focuses mainly on repairing damage after the fact, we're going to miss the investments that prevent the harm and protect us to begin with. So that's why, if we can think about federal disaster reform more holistically, I think we're on the right path there. It can't just focus on whether heat can trigger a disaster declaration. It has to focus on whether federal disaster law can support risk reduction and the level of which and scale of which this issue requires. It should also be clear about eligibility. We've seen in a lot of the programs that are out there, it's very hard for heat to measure up, especially with BCA and other things. It's also really hard to have coordination across federal programs. We have NIHIS that was very active and at one point was coordinated across over 30 federal agencies. Many of those agencies have stopped their heat work, and even though there's still some action on the committee there, the working group. So this is where the Stafford Act could think about connecting, what's happening in heat with broader governance reform. My concern about this approach, though, writ large, about federal emergency management reform in heat, is that this kind of model could unintentionally reinforce that heat is an emergency only thing, that it is not a chronic issue that slowly erodes the systems that our societies depend upon. And that I think would be very dangerous. So I think any kind of integration with federal or emergency management reform should be very careful. So I want to take just a minute and hit some highlights on the two reports that I've already mentioned. I do think they kind of show us where we go next. What's the next generation of heat policy reform? I already talked to you about how the Southeast showed there's like early stage legislative landscapes and where they begin. And California is a demonstration of maybe what a more advanced looks like. Together, I think they kind of give us the conclusion that this next generation has to do more than just name the risk. It has to actually build governance capacity. And so I have a few steps to do that. The first is the importance of naming a lead agency. States should, not only give the authority, but also the mandate and resources to do it. We have to make heat data or data that's relevant to helping us understand the issue available across all systems. Right now, data fragmentation, we collect a lot of data, we just don't integrate it together. We need to pair the standards that we create in law with financing mechanisms. They have to treat enforcement as part of the protection. So enforcement has to be part of the standards. We have to stop treating it as a standalone problem. We have to know that that one solution solves many problems. Tree programs that ignore drought, for example, underperform. So we also have to then think about what we're doing, the programs that we're proposing rather, and what that means within the other systems in which it operates. I've said this so many times. We have to pair what we're doing with insurance and finance mechanisms. I think I've beat that horse. Okay, so what does it mean for all of you on this call? And this is what I was really trying to get to. And I think there's some hope here. For those of you who work in local governments, you may not control every lever, but you have more power than you think. Local governments can integrate heat into their emergency operations, in their capital planning, in their public contracts, in their facility standards, in their transportation partnerships, and any kind of after action review. They can document the costs that they absorb, staff overtime, facility closures, emergency calls, operations, outreach, infrastructure stress. That documentation will give state and federal partners a clearer picture of what heat actually costs at the local level. Critical. Honestly, don't think there's almost nothing more important than this one. Private sector. Heat isn't just a compliance issue. It is a workforce issue, but it's also a supply chain issue and a facilities, operations, liability, continuity issue. Employers can act before regulation requires them to do it. Be proactive. They can assess what their indoor heat risk is. They can plan for outages. Insurers and lenders and investors can begin treating heat protection as risk reduction. The private sector owns and operates too much of the heat relevant infrastructure to sit outside of this solution. That's who owns our health systems, our energy systems, our what, it's really important. They employ almost everybody that's exposed to heat. Academics and researchers. I mean, evidence base is essential, absolutely. Usefulness matters, though. Policymakers need evidence that connects to the decisions they make. It means that researchers have to be clear about who can use their evidence, what kind of decision that evidence supports, what authority it connects to, and how can we think about quantifying the impact of interventions or policies. For nonprofits, I mean, really you're the critical storytellers that humanize this issue. You often see most of the gaps first. You have a better understanding of when cooling centers are not accessible or when workers fear retaliation, when older adults can't afford their electricity, or the lack of coverage and outreach programs that exist. Nonprofits, you translate lived experience, and the potential is that you translate it into smart policy design, because nonprofits are critical in helping us identify the implementation barriers that exist, and also will give us a real gut check on what financial services will work. For our state governments, you kind of sit at the center of this problem, right? You can define it as heat as a formal hazard. You can build coordinating authority across state agencies. You can pair standards with financing. You can prevent and sometimes in the opposite direction, prevent local governments from acting as they would like. For federal partners, you can make it easier to fund projects and plan for those. You can clarify eligibility and update your guidance. You can improve BCA methods, support cross-agency coordination. The common thread in all of this is that each institution has to act through the tools that it already controls. We don't have to have every actor do everything. We need each actor to do the part that only they can do. So I want to end with this core message. Extreme heat policy doesn't fail because people disagree. It fails because the systems that we need to build strong heat governance don't exist. And the work to do that is really practical. We have to identify who controls what lever. We have to frame heat as a fiscal exposure, operational continuity, public health protection, work stability, infrastructure risk. We have to define it as all of those things. It's yes and. We have to build standards that come with the appropriate financing and funding tools. And those tools have to reach the facilities, the households, and the employers with the least capacity to comply. We have to develop methods that are easy to use that can count the value of our investments. And we have to have multi-sectoral representation at the table as we try and solve these problems. We know that heat is serious enough to act. The question is, can our institutions build the authority, the financing structures, the accountability structures that we need to act at scale? And that's where I hope we spend this last few minutes of discussion. Thank you so much for your time.
Ashley, thank you so much. That was fantastic. I always learn so much from your presentations. So I'm going to turn off the recording now.